everyone. Hope you all are doing good. My name is Ananya Pal, and on behalf of Tribeca Care, I welcome you all to this webinar with Dr. Prasenjit Chatterjee. Dr. Chatterjee is an MBBS, DMRT, MD, DNB, radiation oncologist in Behala, Kolkata, and has an experience of more than 31 years in this field. He completed MBBS from Vardhaman Medical College in 1999, Diploma in Radiotherapy from Tata Memorial Hospital, Mumbai in 1996, and DSP Radiation Oncology from Tata Memorial Hospital, Mumbai in 1997. He is associated with Apollo Multispeciality Hospital, Kolkata. Welcome, sir. Hope you are doing good.
Hello. Everybody, greetings for the day. I'm sorry again, apologies for little late joining, got disconnected. Now I am back. So we can start with the session today.
So Dr. Chatterjee, can you please tell our audience what is cancer and who gets cancer?
Yeah, coming directly to the interaction session. So I prefer to speak in English, but I can mix up with Bengali. I think that is reasonable for everybody, right?
Yes, sir. You can definitely talk in English and Bengali.
And I'll be more than happy if there is an interaction, if you can write your query in the chat box, and Ananya is there. We will respond to the question answer session. That will be more meaningful than I am on continuously chatting with you or responding to the questions that may have some corollary discussion with the family members who are there today and eager to participate in this session. So talking about cancer, as you know, being an oncologist and practicing in the city for last 22 years, coming from Tata Hospital. So I am on and off to Tata Hospital and Royal Marsden Hospital, London. So we try to closely collaborate our interactions with the best centers in the world and get upgraded ourselves to the modern treatment of oncology and cancer. Cancer, which is very, very basic thing, and a word which is as big as the pandemic, the COVID, which we are used for last 2 years. Now we want to say that there are multiple number of cells, that is millions of cells in our body. Now these cells are actually every day multiplying and then growing in size, and thereafter they have a normal shelf life and they die after a period of time. Now, due to some reasons, if the cells multiply and don't die, then there is some triggering factors which is working. So this triggering factor is called the genetic makeup of the body. As I told you, there are millions of cells all over the body, starting from scalp down to all of the feet. Now, these cells, if they don't die and multiply, then it can acquire the shape of a mass of tissue in the body, which is actually called a tumor. Now, having said that, all tumors are not malignant. There may be benign tumors, there may be malignant tumors. So, benign tumors is when these cells remain in form of a mass of tissue in the body, like what we see a fibroadenoma in the breast, which is usually prevalent in most of the women in the menstrual period, or a fibroid in the uterus, or maybe for a 60-year gentleman who has an enlarged prostate. So enlarged prostate is not necessarily a prostate cancer. So here comes the subtle difference between a benign tumor and a malignant tumor. Now, if the triggering factor, what I was trying to discuss, is because of the genetic makeup, that may be because of two reasons. One is you acquire these genes from your parents, and these genes are abnormal to begin with. These are few genes which has been identified, and we nowadays routinely do this genetic testing also to identify few cancers which may be present in an individual who has acquired congenitally from their parents. Now these genes are like BRCA1, BRCA2. Genes have a propensity of triggering carcinogenesis or a tuberogenesis in the body. Now, what is carcinogenesis or tuberogenesis? Now, these genes which we acquired congenitally from our parents, if in certain period of time, that may be at the age of 7 years or that may be at the age of 70 years, suddenly gets triggered and cells multiply and develop a process which is called carcinogenesis, then that is a reason of concern for us. Now, having said that, these benign tumors may not be a cause of concern, but some genetic triggering factors which may happen to an individual during the lifetime also. That is, they are acquired. They are not congenitally acquired, but they are acquired during the lifetime. And that we say this is an acquired genetic mutation which is happening. I repeat the word mutation, what we call it. Mutation is what is genetic instability or genetic map present in all the cells of an individual, which is very, very different from a person A or person B. They are all different. No two different individuals are having same genetic map. However, they may be similar, but they are not the same. So that reason is when we call an acquired genetic mutation. So there are two issues. One is congenital, another is acquired. Now, congenital is something, some cancers which has been proven over a period of time, like breast cancer, colorectal cancer, rectum cancer, as well as lung cancer. এই ক্যান্সারগুলো অনেক সময় that may happen if your mother, father, auntie, or uncle, or grandfather, grandparents, or sisters or brothers can have cancers in their lifetime, and there is a possibility that you have congenitally acquired those dangerous genes from your parents, or and then you carry those risk factors. And the acquired is what we don't inherit, but during your lifetime there is some triggering factor which triggers these genes, leading into a mutation. What is mutation? Mutation bolte amra bujhi je gene je mapping ta ache in the body. Now these genes have a typical arrangements in the shape of different proteins which are attached to these genes. যদি কোনো কারণ ট্রিগারিং ফ্যাক্টরস এর জন্য এই জেনেটিক মিউটেশন ডেভেলপ করে, দ্যাট মে বি ডিফারেন্ট টাইপস অফ মিউটেশন, দ্যাট ইজ অ্যান অ্যাবনর্মাল প্যাটার্ন। মানে মিউটেশনের বাংলা যদি বলতে হয় তাহলে বলা যেতে পারে একটা অ্যাবনর্মাল প্যাটার্ন যদি ডেভেলপ করে, তাহলে দ্যাট মে লিড ইনটু ট্রিগারিং অফ দিস সেলস মাল্টিপ্লাইং অ্যান্ড নট ডাইং। অ্যান্ড ওয়ান্স দিস সেলস ডোন্ট ডাই, tuberogenesis বা carcinogenesis can happen, which may lead into malignancy. So when it is malignancy, it is histologically different from a benign tumor, which may also be present as we discussed. So that is all about cancer and how it origin and what is the pathophysiology developing thereafter. Yes, Anurna, I hope I could explain in simple English language, but still I will be more than happy to respond to your other questions which may creep up in your mind.
Yes, sir. Thank you so much. So my next question is, can you please tell us how does the cancer start?
And that is what we actually discussed in our introductory question. Cancer is like, as I told you, there are millions of cells in the body. Now, millions of cells have different shelf life. মানে ধরুন আরবিসি, রেড ব্লাড সেল বা যেটা থেকে হেমোগ্লোবিন, ওটা শেলফ লাইফ হলো 120 days or 120 days. সিমিলারলি লিউকোসাইট বা হোয়াইট ব্লাড সেলস, তারও একটা শেলফ লাইফ আছে, নর্মালি উই সে 7 to 8 days. আবার প্লেটিলেটস বা থ্রম্বোসাইটস, ইট হ্যাজ আ শেলফ লাইফ অনলি ফর 24 hours. তো প্রত্যেকটা শেলফ লাইফ ডিফারেন্ট। বডিতে লাং ক্যান্সার, লাং প্যারেনকাইমাতে এক ধরনের সেল আছে, আবার স্টোমাক এও আরেক ধরনের সেল আছে, আবার ইউটেরাসেও এক ধরনের সেল আছে। Now these cells all normally is small, multiplying and dying. But these cells, if they don't die because of some genetic trigger, যেটা এতক্ষণ ধরে বোঝাচ্ছিলাম, তাহলে it can acquire the shape of malignancy in 7 to 8% of the situation. and in 70 to 80% of the situation it can develop into a tumor, but সেটা harmful নয়, সেটাকে আমরা benign tumor বলি, সেটা আমাদের মধ্যে অনেকেরই থাকে and which can remain, we don't need an intervention, but that has to be clarified by an oncologist যে কোনটা benign tumor, কোনটা malignant tumor. Malignant tumor হলে intervention দরকার, we need to prove the diagnosis through some radiological or imaging test, through a biopsy বা FNAC বা needle test যেটাকে সাধারণ ভাষায় বলা হয়। তো সেটা actually has to be clarified and proved clinically before coming into a conclusion or clinching the diagnosis. That is the way forward, Ananda. Next question.
Yes. So our next question is, as we provide service to senior citizens, can you please explain in detail that how cancer and aging is related to each other?
That's a very interesting question. I would say that cancer and aging certainly has a meaning. Why I'm saying is, aging is inevitably a time-dependent decline in the physiological organ function and a major risk factor for cancer development. Now, what I mean by that, actually, over a period of time, last 20 or 30 years, there is a lot of advance in healthcare, hygiene control, food availability, life expectancy is increasing, and the population in most developed countries is shifting to an increasing proportion of people at a cancer in susceptible age, what I'm saying. Now, mechanism of aging are also found to occur in carcinogenesis, what I was trying to explain to you in the previous question answer session. Now, it is now clear that aging and cancer development either share or diverge in different disease mechanisms. Now, what I want to say is, such mechanisms include the role of like genomic instability, telomere attrition. Telomere attrition হলো cell cycle এর একটা চারটে stage হয়। So telomere is actually the last stage where a cell ultimately develops into a mature. তো সেই telomere stage-টা যদি ছোট হয়ে যায়, telomere attrition যেটাকে বলি, তাহলে there is a possibility that a cancer can start developing in the body. What I want to explain to you is, during a lifetime, especially after 50 to 60 years of life, the normal cells in the body, actually physiological process, actually starts behaving in a different process. মানে normal process এ যেটা physiological growth হয়, cells multiply, cells die, again cells start multiplying and cells die. এই যে physiology-টা is being hampered due to some triggering factor or some limiting factors which comes into play in the life of a cell cycle. Cell cycle এর যে চারটে স্টেজ আছে, সেই চারটে স্টেজে কোথাও একটা নিউ ইন্টারভেনশন হয়, especially after 50 years and 60 years, for which these mechanisms develop. তার জন্য বলা হয় যে especially with aging, the susceptibility to cancer is increasing. And as I told you in last few sentences, the life expectancy due to whatever reasons, because of modern science development, healthcare development, and of course, life expectancy has increased because of better quality of life for people, mostly in developed countries and also in developing countries. So that is there is some interconnection, a very, very subtle interconnection between aging and carcinogenesis. Now, a telomere attrition by epigenetic changes, by genomic instability, by cellular senescence, যেগুলো হলো different basic pathophysiology which is every day and constantly taking in an individual's body. And it is that behavior, that physiological process is actually little bit distorted, যদি খুব simple English এ বলতে হয়, during the age process as an individual acquires the age of 50 years, 60 years, and more so when it is 70 years, 75 years. So age একটা dynamic equilibrium between the process যেখানে জেনেটিক ইনস্টেবিলিটি, এপিজেনেটিক চেঞ্জেস, সেলুলার সেনেসেন্স, এই যে বিহেভিয়ার গুলো, সেলের যে ডিফারেন্ট মেকানিজমস অফ অ্যাকশনস গুলো হয়, through which the cells multiply and then they die. But if they don't die, they clump together and start growing in an abnormal behavior, which results in formation of a tumor. Thus, we say cancer cells and aged cells, they are fundamentally opposite actually. And this can be thought to be a very hyperactive cells with advantageous mutation. They are more prone and susceptible to mutations, and they are hyperactive. Whereas other cells like aging cells, cells of an individual who is 60 years or who is 75 years, তাদের কিন্তু cells are relatively hypoactive, that is less active, and they are not so much prone to mutations. So এই যে একটা intermingling dynamic equilibrium, এই মিলিউটা বডির ভেতরে চেঞ্জ হয়, thus triggering a process of multiplication cells and forming a tumor mass in the body because of some extrinsic factor, which may be a acquired genetic mutation, or because of some genes which you are carrying from your life at birth, where these genes were present in your parents, maybe father or mother or both, and they are also present in your brothers or in your sisters, যারও হয়তো লাইফ টাইমে 20% রিস্ক হতে পারে ক্যান্সার হওয়ার। আর যদি এই জেনেটিক এগুলো না থাকে, তাহলে probably you don't carry that risk. So today we have entered into a very crucial and very different mechanisms which the world over scientists could identify these genes are present in your body or not. তাই জন্য এখন modern cancer geneticist বলে নতুন একটা discipline হয়েছে, where geneticists are trying to identify whether you are having those cancer genes which are active in your body from your birth, or maybe at one point of time, 60 years, whether you have some lifetime risk factors, like you are obese person, like you are having a smoking and alcohol history, or you are doing an occupation which has exposure to the metals and exposure to the industrial exposure like chemicals and carcinogen, যাদের লাং ক্যান্সারের প্রবণতাটা বেশি হয়। সুতরাং এই লাইফস্টাইল এন্ড রিস্ক ফ্যাক্টরস যাদের আছে, that maybe somebody is very sedentary, obese, কোনো রকমের physical activity করে না, বা suppose a woman who is not married, who has never conceived, who has never breastfed a child, বা যেগুলো বললাম যে who works in a dye industry, ধরুন dye ইন্ডাস্ট্রিতে একজন ভদ্রলোক কাজ করছে last 40 years because that is his profession, but he is exposed to some types of external carcinogen. এই যে আমরা রাস্তাঘাটে ঘুরে বেড়াচ্ছি, there is excessive occupational exposure because of the smoke coming from the vehicles, moving vehicles. And why this is being coming again and again in the media and news, the occupational exposure happens in Delhi, in city like Kolkata, যেখানে acquired index particle in the air, and that is extremely detrimental for an individual because he or she is exposed to different types of lung diseases that may be fibrosis হতে পারে, emphysema হতে পারে, বা ক্যান্সারও হতে পারে। সুতরাং অনেক সময় these chemical carcinogens not only cause lung cancer, it may cause other cancers like urinary bladder cancer, যেটা বলছিলাম যে ডাই ইন্ডাস্ট্রিতে কাজ করা হয়, মানে ধরুন এই লেদার ফ্যাক্টরি আমাদের যে ট্যাংরাতে আছে, বা যে লেদার ফ্যাক্টরিতে এত মানে লোকজন কাজ করছে বছরের পর বছর, they are continuously being exposed to some types of external carcinogens. So these may have a intertwining factors where aging certainly plays an important role in some types of carcinogenesis. So cancer can be considered an aging process, though the shared mechanisms and underpinning of the two processes is still very much unclear, and better understanding is possible through the shared and divergent pathways of aging and cancer. So certainly there are a lot of publications which has happened in last 1 decade over aging and cancer. So that is where we have a important that as one individual ages, he or she is susceptible to develop a cancer, that risk increases, not to an alarming degree. তাই জন্য আমরা অনেক সময় বলি যে screening process is very much compulsory. কিছু কিছু common cancers যেমন lung cancer, cervix cancer, prostate cancer এখানে screen করা হয়, মানে every individual residing in a developed country like United Kingdom বা North America, এদের কিন্তু বছরে একবার করে স্ক্রিনিং হয়। Different types of screenings are there. That is not, I mean, waste of time. I'll not discuss in this question and answer. But screening can pick up the disease in an early stage. And this is কখন usually আমরা স্ক্রিনটা করি, not for gentlemen aged 30 years or 40 years. Usually এটা 45, 50 বা 65, 70 তখন থেকে স্ক্রিনিংটা করা হয়। So what we do, মানে আমি জাস্ট এই পরিপ্রেক্ষিতে বলি আর কি, আমাদের দেশে তো স্ক্রিনিংটা সম্ভব না বিকজ অফ এক্সেসিভ পপুলেশন এক্সপ্লোশন, মানে হোল পপুলেশন এট মাস উই ক্যানট ডু দিস স্ক্রিনিং টু পিক আপ দ্য ডিজিজ এট আর্লি স্টেজ। তো যারা অ্যাট রিস্ক ফ্যাক্টর, মানে যার ফ্যামিলি হিস্ট্রি আছে, ধরুন মা, বোন, মাসি, দিদা, কারো ব্রেস্ট ক্যান্সার বা ওভারি ক্যান্সার হয়েছে, তাদেরকে আমরা বলি আপনারা স্ক্রিনিংটা করুন, যে আপনার একটা 7 to 10% রিস্ক আছে। বা ওই জিন টেস্ট যেটা একটু আগে বলছিলাম, BRCA1, BRCA2, এই জিন পরীক্ষাগুলো করি, তাহলে তাদের রিস্কটা কিন্তু 7 to 10%-এর জায়গায় 20 to 25% আছে। সুতরাং যার দুটোই রিস্ক ফ্যাক্টর আছে, মানে ফ্যামিলি হিস্ট্রি প্লাস জেনেটিক জিন গুলো পজিটিভ, মানে ব্যাড জিনস আই এম টকিং অ্যাবাউট, ঠিক আছে, তো সেই জিনস গুলো যদি হয় তাহলে you should more rigorously do a screening test that we cannot do for everybody. So that is where the intricate relationship between the aging and cancer is well dramatized and well documented in the papers of clinics. Thank you, Ananda. I think I was a little lengthy, but that needs a discussion and clarification.
Yes, definitely. So we can say that when someone has a family history of hereditary cancer, so genetic testing is often recommended.
Right, absolutely, very, very important. And now this is also happening in the city of Kolkata. We have many centers we do genetic testing. এবং আবার বলে দিই, জেনেটিক টেস্টিং কিন্তু ইউজুয়ালি we don't do at random for the population at large. যাদের ওই 4-5টা ক্যান্সার এখন অব্দি মানে প্রুভড হয়েছে through clinical mechanism and that has been published, all oncologists who are educated and up to date, they know about it. And এখন যেটা বললাম, ক্যান্সার জেনেটিসিস্ট is a new subject and new discipline. বড় বড় হসপিটাল, মেডিকেল কলেজে এখন ক্যান্সার জেনেটিসিস্টও একজন মানে ডিসিপ্লিন প্র্যাকটিস করেন, যারা ট্রাই টু আইডেন্টিফাই ইয়োর রিস্ক ফ্যাক্টর স্ট্র্যাটিফিকেশন, যে আপনার রিস্কটা 20% আছে, সো ইউ শুড ডু। Usually cancers like breast cancer, ovary cancer, colorectal cancer, মানে rectum colon, lung cancer and finally prostate cancer. এই 5টা ক্যান্সার এ যাদের আছে ফ্যামিলি হিস্ট্রি, তাদেরকে আমরা বলি ইউ শুড ডু আ জেনেটিক টেস্টিং। এই টেস্টটা আগে 40,000 রুপিস লাগতো, 2 বছর আগে 20,000 টাকা লাগতো, and এখন let me tell you this only takes 7,000 rupees and we have more than 10 to 15 centers in Kolkata যারা এই টেস্ট করা হয়। ওই কিছু কিছু যেমন আমি নাম বললাম, ব্যাড জিনস মানে BRCA1, BRCA2 জিনস, যেগুলো আর ব্যাড জিনস if they are present in your tissue, and this can be done by a simple blood test. আবার রিপিট করি, it's a simple blood test or a saliva test through which we can identify these genes. Thank you, Ananda.
Thank you, sir. So my next question is, can you please tell us what are the most common cancer in older adults and what are their symptoms?
Yes, very, very pertinent question that needs a discussion also. I would say normally old age cancer we can divide into men and women population. If we talk about men at large, tahole prostate cancer is the leading cancer which needs a discussion, je that is common among old population, usually after 65 years of age. Other common cancer in men, which is more common in old age, is lung cancer. Again, this propensity increases from the age of 45 to 50 years. And as the age increases, it is usually more, the chance of incidence increases for old age population. So, প্রধানভাবে যদি বলি men population, তাহলে breast cancer, lung, prostate cancer and lung cancer, they are the common cancers for old age population. But having said that, trailing other cancers are head and neck cancers, the GI cancers, মানে stomach, gallbladder, liver, pancreas, যে ক্যান্সার গুলো হয়, that can also be normally a cancer of the old age. Old age is, the definition of old age has changed now because the people we say middle age has another মানে নতুন definition which has come. We normally say 40 years to 55 years is middle age, and after 55 years we say normally it's the elderly population. And elderly population is usually geriatric population in a subgroup. And geriatric is when we say the age group is beyond 65 years. So it is actually a very, 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 not a very, very well defined. It is still very, very mixed issue so far if you talk about old age. And old age 45 to 55 কেও বলা হয়, আবার 55 to 75 কেও old age বলা হয়. So head and neck cancer, prostate cancer, lung cancer, GI cancer, these are all usually cancers of the old age. Similarly, old age for women cancer is breast cancer, 1 to 10, that is the commonest cancer, especially in the metropolitan and urban population. আমাদের দেশে cervix cancer, মানে tip of the uterus, যেটা ছিল সেটাকে, am I audible? Ananya, am I audible?
Yes, sir, you are audible.
So I could see there is internet instability. So I thought I'll just have a query. So cervix cancer is another cancer which is the tip of the uterus, is usually also considered an cancer of the old age group. So that old age group may be from the age of 45 to 50, and it increases as one ages from 55 to 70 years. Uterus cancer is also a common cancer of the old age population, and ovary and uterus cancer is usually more common for people of older age group who are essentially obese. মানে আমরা body mass index দেখে ক্যালকুলেট করি যে old age কাকে বলা হয় এবং obese কাকে বলা হয়. So usually body mass index যদি একটা particular value বেশি হয়, we normally say it is more than 2.5, 2.8, then it is alarming. There is a good chance that you can develop a uterus cancer, ovary cancer, and also breast cancer. So breast, ovary, and uterus are usually the cancers of the old age population in women. So that answers my question of old age population and cancer. Yes, Ananda.
Yes, to sum it up, we can say that in older males, lung cancer, prostate cancer, and GI cancer are the most commonly seen in older males. And in females, we can say that breast cancer, cervix cancer, uterus cancer, and ovary cancer. These are generally seen in older females.
Perfect.
Okay. So going forward to my next question, which is there any warning sign for cancer?
Yes, very, very important question. In fact, আমাদের ক্যান্সারের এত যে লেকচার দিই, that is the basic thing, we use the word caution, CAUTION. Normally, as a healthcare giver, I would say that most of the time we give lecture in different places, that is not only in the hospitals, but like today we are there in a closed session. I do give lecture in other offices, institutes, teaching institutes. Last week I was in Lord George College, কারণ এই World Health Day was actually 7th of April. So that 7th of April, I went to this George College of Management, যেখানে hospital management পড়ানো হয়, and I gave a lecture on this, যেখানে আমরা we discussed about that warning signs, what one should be cautious about. Very simply speaking, there are some things which needs to be alarmed, or which one should be aware that this is not a normal process, like abnormal vaginal bleeding, unexplained weight loss, constant feeling of fatigability, pain in the pelvic area, কোমর এবং তার নিচে যন্ত্রণা হচ্ছে বা পিঠে যন্ত্রণা হচ্ছে, which is not getting resolved with medication but getting resolved, but again it is coming. Change in the bowel habits, কখনো কখনো constipation, কখনো কখনো loose motion, আমি ওষুধ খাচ্ছি ঠিক আছি, আবার 1.5-2 মাস বাদে ডাক্তারবাবু এই সমস্যাগুলো হচ্ছে। কাশির সঙ্গে রক্ত, কাশি হয়ে যাচ্ছে, কখনো কখনো একটু রক্ত ছিটে আছে, অ্যান্টিবায়োটিক ডাক্তারবাবুর কাছে গেলাম, ওষুধ দিলেন, ঠিক হলো, আবার 1-1.5 মাস বাদে একটু কাশি হলো, বা কাশির সঙ্গে রক্ত ছিটে হতেও পারে, বা হলো হেমোপটিসিস বলি। আনএক্সপ্লেইনড ওয়েট লস, যেটা বললাম, ইউজুয়ালি আমরা বলি যদি 10% ওয়েট লস বেশি হয় in over a period of last 6 months, মানে refer to a family physician or your referring physician to take his or her opinion. Is there some underlying pathology which is causing this weight loss? Change in shape of the size of the breast, but change in shape of the nipples, again something very 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 alarming. I would say আমরা breast cancer program যখন করি, which separately itself a separate topic, we discuss about breast cancer inspection, palpation. We teach our healthcare workers, মানে normal population age group, women at the age of 40 years and beyond, that why they should have an inspection, that is very self breast examination বলা হয়, where you should have a knowledge about the nipple retraction হচ্ছে কিনা, but shape of the breast between the left and the right, or right and the left, there is some disparity which was not there and it is creeping up. You can see in the mirror. These are some words of caution which one should consult a physician, or if he or she needs, then he could consult a pulmonologist. যার ধরুন কাশির সঙ্গে রক্ত বেরোচ্ছে বা কাশির সঙ্গে ওয়েট লস আছে, it can be a combination of factors, vaginal bleeding হচ্ছে, বা মেনোপজ হয়ে গেছে, পিরিয়ড বন্ধ হয়ে গেল, হঠাৎ করে স্পটিং হলো, মানে ইউসির বা মহিলারা অনেক সময় বলেন যে আমরা হঠাৎ করে দেখলাম যে 1 ফোঁটা বা 2 ফোঁটা ব্লাড বেরোচ্ছে, বা অল্টার্ড বাওয়াল হ্যাবিটস, যেটা বললাম মহিলাদের কমন, একটা ছেলেদেরও হতে পারে। এই যে লাস্ট 2 বছর ধরে মাঝে মাঝেই ডাক্তারবাবু আমার কিন্তু কনস্টিপেশনের সমস্যা আছে, আবার ওষুধ খেলাম, আমার ডায়রিয়া হলো, কন্ট্রোল হয়ে গেল, 1-2 মাস ভালো থাকলাম, আবার এটা কিন্তু ডায়রিয়া হচ্ছে বা কনস্টিপেশন হচ্ছে, এটাকে অল্টার্ড বাওয়াল হ্যাবিটস বলা হয়। So these are all conglomeration of the warning signs which needs to be put your alarm bells on, that you should not let go. You should consult a physician, take his or her expert opinion, and don't ask your neighbor or your colleague এবং pop up a pill that you can do. One প্যারাসিটামল একবার খেতেই পারেন, যে একটা মাথায় হালকা হেডেক হচ্ছে, ওষুধ একটা খেলেন, but going on doing it then can lead into adverse side effects, and that will not dig out the main cause, the etiopathogenesis, the cause of the reason of the symptom which is happening. So once again I would like to alert you, please 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 don't take medicine, self medication বা গুগল মেডিসিন। গুগল ডাক্তারবাবু এখন খুব ফেমাস, সবাই এখন গুগল করেন এবং নিশ্চয়ই করবেন, আমি সেটা বলছি না, but information overload is certainly a major problem. You try to search your symptoms in the Google, at the end of the day you are perplexed and confused what is actually happening within your body. So try to consult a physician. আমি জানি there is limitation, আগে এখন যেমন আজকালকার দিনে we don't get a family physician. আগেকার দিনে যেমন family physician was a very very prevalent thing, প্রত্যেক পাড়ায় পাড়ায় ডাক্তারবাবুরা থাকতেন এবং ফ্যামিলি ফিজিশিয়ান ব্যাপারটা খুব চল ছিল। এখন ডিউ টু মেথড অফ প্র্যাকটিস and methodology, the government promotion, and because of medical ethics, family physician ব্যাপারটা কিন্তু obsolete হয়ে যাচ্ছে, which is certainly very, very detrimental for the society at large. But having said that, because we are developing, the economy is progressing, there is some changes which are also bad for the society, and that we have to accept the reality, and we have to understand at what level we can interject or intervene to find out a solution. যেমন ফ্যামিলি ফিজিশিয়ান যেটা নিয়ে আমরা আলোচনা করি প্রত্যেক মিটিং এও, এবং আমাদের যখন ফ্যামিলি কেয়ার ফিজিশিয়ানের একটা বড় গ্রুপও আছে, though it is becoming redundant, but we always try to promote that there should be a family physician. Ultimately, he or she should be the caregiver of a conglomeration of patients in that para. সেটা শক্তিগড়ের বাইপাসই হোক আর সেটা ধরুন শান্তিপুরের গ্রামেই হোক, আমাদের এই পাড়ার ডাক্তারবাবু কনসেপ্টটা কিন্তু ইজ ভেরি ভেরি ইম্পর্টেন্ট, বাট আনফর্চুনেটলি বিকজ অফ আওয়ার ডেভেলপমেন্ট অ্যান্ড প্রোগ্রেস the method of practice is more hospital based. তাই জন্য আমরাও হয়তো ডাক্তার পেশেন্টদের বা পাড়ার প্রতিবেশী বা পরিচিতদের বলি যে প্লিজ হাসপাতালে ভিজিট করুন, which becomes cumbersome for the patient and the family member. সবাইকার পক্ষে অনেক অসুবিধা আছে, অনেক এলডারলি পপুলেশন সল্টলেকে থাকেন, এবং সল্টলেক যেহেতু আমার প্র্যাকটিসের জায়গা, and I would like to tell that Tribeca plays a very, very important role. We need more such Tribecas coming up in different paras and different locality, more so in the rural population where access to healthcare is much, much limited. So I would use this platform to tell Tribeca organizers, why not we work out together with the local physicians and local healthcare givers that may not be all qualified doctors. We can take help of Ayurveda doctors also. We can take help of the homeopathy doctor also. Now, because of the National Medical Council and skeleton work, which was previously recognized by Medical Council, এখন সেটা National Medical Commission হয়ে গেছে, NMC বলা হয়, has recognized the Ayurveds also and homeopaths. So we have to think about how best we fit in so healthcare structure improves. এই pandemic আমাদের শিখিয়ে দিয়েছে, not only for Kolkata, India, Bengal, but world over globally, that we need to gear up so far as the health structure is concerned, and the government also has to think about how the GDP for healthcare has to be improved. Healthcare structure টাকে আরো better এবং structured করতে হবে, তা নাহলে it is not possible to cater the population like 1.35 billion. So we can go on lecturing on this topic, or I'm so sorry about it, but that needs a discussion also, because ultimately awareness usually happens through discussion. In fact, the India today is so vulnerable from the bordering countries. There is so much of war going on throughout the world, not only surrounding India, but that is also happening in Asia, Europe, Middle East, North America. Everybody is so much vulnerable. Why it is so? Because we are all feeling threatened about it. So the Defense Ministry has definitely popped up the defense budget. সেরকম ভাবে healthcare also needs extra attention. The government should be represented by members who are actually experts and they are doctors. So I would thank the central health government. There have been enough representation in the National Medical Council and Health Ministry where there are qualified doctors to guide the administration how best we should fit in. I think we can see the change in next 10 years. It is not possible একদিনে overnight radical changes হবে, but lot of things are working positively so far as the health sector is concerned in India. We are a population of unity in diversity. So I know lot of cultures, ধরুন কিছু কিছু ক্যান্সার বেঙ্গলে খুব কমন, কিন্তু আবার বম্বেতে সেই ক্যান্সার অতটা কমন নয়, because of the lifestyle and culture, because of food habits, because of different other reasons. So that has to be individually streamlined. So that works, that আমাদের প্রত্যেক সেক্টরে, starting from Anganwadi worker who are actually doing the footwork at the rural, গ্রামে গঞ্জে যারা কাজ করছে, তাদের সঙ্গে we have to team up, and how best we can develop a common platform so that the নতুন information বা নতুন publication বা নতুন তথ্য যেটা তৈরি হচ্ছে, that that information can be percolated or disseminated ground level reality to the remotest corner in the village, not only for the urban population. আজকে আমি আপনি হয়তো জুমে বা নেটওয়ার্কে কথা বলতে পারছি, but this facility, they are not so privileged to get this facility to educate also, but that is important that also they have an opportunity to get educated at their level. তো সেই জন্য আমি যে আজকে যে আমাদের এখানে দেখতে পাচ্ছি we have population of 22 people who are there and listening to me. I would say thank them that they are also listening, because they in their part has a responsibility. Everybody of you, I may not know all of you, but personally I would say that all of us has some responsibility on your part after this discussion for 1 hour to sensitize your locality, your para, your neighborhood, your institute where you are working, to organize one healthcare awareness program. That may be cancer, that may be COVID, that may be other infection diseases which are common, tuberculosis, যেটা আজকে থেকে 10 বছর আগে was a major problem in a country like India. আজকে, because I would thank the government and the National Tuberculosis Control Program, the tuberculosis has been calmed in a major way in a country where 60% of the population used to die from tuberculosis. Similarly, we have to understand in cancer also we have to do that. আজকে tobacco, which is a major hazard, as you know, মানে আমাদের এখন ইন্ডিয়াতে, so far as 2018 and 2020 data concerned, every year 13 lakh population has been diagnosed with new cancer. I mean, repeat kochi for my friends and well-wishers who are there with me, that we have a population of 1.3 billion plus, এর মধ্যে কিন্তু 13 লাখ নিউ ক্যান্সার কেসেস ডায়াগনোসিস হচ্ছে এভরি ইয়ার, এবং ডেটা 2018, 2019, 2020 ডেটা, 2021 ডেটা এখনো আমাদের কাছে আসেনি। প্রবাবলি by the year end we will get the data for 2021. তার মধ্যে 3.7 lakhs, I repeat, 3.7 lakhs new cases of cancer is only tobacco related cancer. And again, this is 2018 data. Maybe 2021 it is far worse and alarming, but 3.7 lakhs cancer can be prevented if we can curb on tobacco. So that is again a big topic, why tobacco is not banned in a country like India. That needs further discussion. We'll not get into that diverse point. But এইগুলো তথ্যগুলো is something we drew or we develop from the data like hospital based cancer registry বা population based cancer registry, যেখানে থেকে আমরা এই তথ্যগুলো পেয়ে we ডেটাগুলো শেয়ার করতে চাই, এবং সেই ডেটাগুলো কিন্তু আবার আমাদের সোসাইটিতে sensitize করতে হবে, জানাতে হবে যে how this can be curbed. So this go on discussion. So we were talking on something else and we have diverted to different topic. Sorry, Anunda, for that. Come to the, we'll just get into the next question.
Thank you, sir, for explaining in such a descriptive manner. And I definitely agree that there are so many topics to discuss. But since we have limited time in our hands, so let's move on to our next question, which is we often hear that if detected at early stage, cancer can be cured. Can you please explain that what are the stages of cancer and what does they mean?
Yes, very, very important question. Normally cancer bolte amra 4টে stage বুঝতে পারি। 4টে stage মানে stage 1, stage 2, stage 3 and stage 4. So there are 4 stages of cancer. I'll not get into the nitty-gritty of stage 1, stage 2 and to bore you on a working day evening. I know everybody is busy, everybody had their work schedule, and after that we are listening to a topic which is may not be so interesting as all of you are a little bit fatigued, but I would say early stage and advanced stage, এই দুটো stage আমরা খুব simplified way তে classify করতে পারি about cancer. So stage 1 and stage 2 is usually early stage cancer, and stage 3 cancer. So stage 1, stage 2 is early stage cancer. Why we classify or stratify in that way is because of the fact early stage cancer is potentially curable cancer. I repeat, early stage cancer মানে কিন্তু কিওর হয়ে যাওয়ার সম্ভাবনা আছে। So advanced stage cancer is always a problem because the chance of potential cure is limited in advanced stage. তো স্টেজ 1 and স্টেজ 2 আমরা কখন বলি? স্টেজ 1 হলো লিমিটেড টু দ্য অর্গান or it is less than 2 সেন্টিমিটার সাইজ। খুব সিম্পল ভাষায় বলা হয় স্টেজ 1 ক্যান্সার যদি টিউমারের সাইজটা 2 সেন্টিমিটারের কম হয় বা ইট ইজ লিমিটেড টু অনলি অর্গান লাইক টনসিল, শুধু টনসিলে আছে, টনসিল থেকে জিবে বা টাঙে স্প্রেড করেনি, তখন আমরা বলি ওটাকে স্টেজ 1। আর স্টেজ 2 বলা হয় if the size is more than 2 centimeter, if the size is more than 2 centimeter or if it involved an adjoining organ, মানে টনসিল থেকে ধরুন সফট প্যালেটে গেছে, মানে ওই তালুতে হয়তো ছুঁয়েছে বা একটু আগে বললাম যেটা বেস টাঙে ছুঁয়েছে, তখন সেটা স্টেজ 2। Similarly, stage 3 কখন বলি? If the size is more than 5 centimeter, তার মানে large tumor essentially, or it has involved more than 2 sites, মানে ধরুন একটা টনসিলের টিউমার যেটা বলছিলাম সেটা জিভেও ছুঁয়েছে আবার কিন্তু ল্যারিংসের দিকেও নেমে এসছে, অর্থাৎ ভয়েস বক্সেও এসে গেছে, তখন কিন্তু সেটা রিলেটিভলি অ্যাডভান্সড ক্যান্সার, স্টেজ 3 ক্যান্সার। আর স্টেজ 4 ক্যান্সার যেটা খুব ইম্পর্টেন্ট আমাদের জানা উচিত, স্টেজ 4 মানে কিন্তু অলরেডি স্প্রেড হ্যাজ হ্যাপেন টু আ ডিস্টেন্ট স্ট্রাকচার, আমরা ডিস্টেন্ট স্ট্রাকচার বলি, অর্থাৎ ডিস্টেন্ট মেটাস্টেসিস হয়ে গেছে। ডিস্টেন্ট মেটাস্টেসিস বলতে কি হয়? আমরা ইউজুয়ালি বলা হয় লিভার, লাং, ব্রেন, বোন বা স্পাইনাল কর্ড, এই 5টা জায়গায় যদি স্প্রেড করে থাকে, লাং, লিভার, বোন, স্পাইনাল কর্ড বা ব্রেন, তাহলে আমরা বলি it is already a stage 4 cancer. Essentially, stage 4 is mostly where we cannot offer a curative option. There's been a lot of নতুন therapy এসছে, immunotherapy, which is being offered to the stage 4 cancers, and those who are living for 3 to 6 months, even a decade back, living in stage 4 cancer for 2 years to 3 years, সেটাও যেমন খুব উন্নতি হয়েছে মডার্ন মেডিকেল সায়েন্স, সিমিলারলি এখন ডাউন স্টেজিং অফ ক্যান্সারটাও খুব প্রধানভাবে উৎপত্তি পেয়েছে, এবং যেটা বললাম আমাদের যে ক্যান্সার রেজিস্ট্রির মাধ্যমে ইন্ডিয়ার মতন দেশে we have been able to downstage cancer, মানে 20% of the cancer যেটা 2010-এ স্টেজ 3 স্টেজ 4 হতো, তার 20% ক্যান্সার কিন্তু স্টেজ 1 স্টেজ 2 তে এখন ডায়াগনোসিস হচ্ছে। অর্থাৎ 2010-এর আগে ধরুন যে কোনো ক্যান্সার, সেটা লাং ক্যান্সারই হোক বা ব্রেস্ট ক্যান্সারই হোক, আগে স্টেজ 3 তে বা স্টেজ 4 এ প্রথমবার ডায়াগনোসিস হলো, ডাক্তারবাবু ডায়াগনোসিস করলেন, সেইটা কিন্তু 100 জনের মধ্যে 20 জনের কিন্তু এখন সেটা আগের দিকে এগিয়ে এসছে স্টেজ 1 অবা স্টেজ 2 তে। তার মানে তথ্য হিসেবে আমরা এখন জানতে পাচ্ছি যে যারা আগে আর কি ধরুন 100 জনের মধ্যে স্টেজ 3 স্টেজ 4 হতো, আমাদের 70%, মানে ম্যাক্সিমাম কেসই স্টেজ 3 স্টেজ 4 বা অ্যাডভান্স ক্যান্সার ডায়াগনোসিস হতো, তার 20% ক্যান্সার মানে ধরুন 30 জন আর কি কিন্তু এখন সেটা স্টেজ 1 স্টেজ 2 তে ডায়াগনোসিস হতে পারছে। সেটা কেন পারছে? Again, because of development which has happened. That is not, I would say, only that improved diagnosis, but because of increased awareness which has happened in the society. আগে কিন্তু মানে শহরেও বলুন এতগুলো ক্যান্সার 2004-এ, আমি তো কলকাতায় 2000 থেকে প্র্যাকটিস করছি, 2004-এ কলকাতা শহরে ক্যান্সারের সেটআপ কোনো ছিল না। তখনকার দিনে ক্যান্সার হলে পরে নয় গাইনোকোলজিস্টরা ইউটেরাস ক্যান্সার, ওভারি ক্যান্সার চিকিৎসা করতেন, বা হয়তো সার্জনরা এটা চিকিৎসা করতো, তারপরে রেডিয়েশন অঙ্কোলজি ট্রিটমেন্টটা হতো, রেডিয়েশন ডিপার্টমেন্ট ছিল, বাট কোয়ালিফাইড অঙ্কোলজি হসপিটাল বা ডিপার্টমেন্ট আগে প্রাইভেটে ছিল না। মেডিকেল কলেজ দু একটা ছিল, চিত্তরঞ্জন ক্যান্সার হসপিটাল আমাদের ফার্স্ট ক্যান্সার হসপিটাল কলকাতা, যেটা হাজিরাতে আছে, এবং এখন তার একটা ব্রাঞ্চও রাজারহাটে হয়ে গেছে। অনেকেই আপনারা সল্টলেক রাজারহাটে থাকেন, জানেন এটা। সুতরাং লাস্ট 20 years leaps and bounds has happened, at least so far as Bengal is concerned. মেডিকেল কলেজ শুধু কলকাতা নয়, বর্ধমান মেডিকেল কলেজ এবং বাঁকুড়া মেডিকেল কলেজ, নর্থ বেঙ্গল মেডিকেল কলেজেও রেডিয়েশন ডিপার্টমেন্ট এখন হয়ে গেছে, যেটা কিন্তু 2000-এর আর্লি 2005-এ ছিল না। সুতরাং এখন লট অফ ডেভেলপমেন্ট হ্যাজ হ্যাপেন্ড। কর্পোরেট হাসপাতাল কলকাতায় আমরি এমআরআই ঢাকুরিয়া প্রথম কর্পোরেট হাসপাতাল যেখানে ক্যান্সারের সেট এবং ডিসিপ্লিন হয়, এবং আমি সেটা জয়েন করি, এবং এই তত্ত্বাবধানে আমাদের ক্যান্সার সেট এখন কলকাতা শহরে অ্যাটলিস্ট 15টা ক্যান্সার সেন্টার আছে। এখন টাটা মেডিকেল সেন্টারও একটা হয়েছে, যদিও টাটা মেডিকেল সেন্টারের সঙ্গে বম্বে টাটা হাসপাতাল যেখানকার আমি ডাক্তার সেই সেন্টারের কোনো সম্পর্ক নেই, বাট কলকাতায় একটা টাটাও ক্যান্সার হাসপাতাল শুরু করেছে। সো টুডে ক্যালকাটা ইজ সার্টেনলি ভেরি ভেরি ওয়েল ইকুইপড সো ফার অ্যাজ ডায়াগনোসিস অ্যান্ড ট্রিটমেন্ট অফ ক্যান্সার ইজ কনসার্ন। যার জন্য যেই কথাটা আলোচনা করছিলাম, 20% ক্যান্সার যেটা আগে স্টেজ 3 স্টেজ 4 হতো, এবং তার 70%-এর 20% ক্যান্সার কিন্তু এখন স্টেজ 1 স্টেজ 2 তে ডায়াগনোসিস হচ্ছে। দ্যাট ডিসকাসেস that we have been able to do a breakthrough in early diagnosis. Early diagnosis is very important for cure of cancer. So that is what, in a very brief way, we can say stages of cancer. Yes, Ananta, if you are there, can we
Yes,
get
sir.
to the next question?
Yes, sir. One more important question is, when should we go for surgery in cancer and how it helps in speedy recovery?
Yes, again, very, very, very pertinent question. Now, surgery, I would say, is one modality of treatment of cancer. Essentially, cancer is তিনটে modality হয়. One surgery, two is, number three is chemotherapy. The other modality is hormone therapy. Usually, prostate cancer, breast cancer, we have hormone therapy also. So there are what sequence of treatment an individual with a cancer will require is actually decided in a proper cancer center is through a multidisciplinary tumor board. এখন অনেক হাসপাতালেই মাল্টিডিসিপ্লিনারি টিউমার বোর্ড হয়। আমি যেই হাসপাতালে যাই, লাইক অ্যাপোলো এন্ড এমআরআই, we also have tumor boards. একজন ইন্ডিভিজুয়াল পেশেন্ট এ, ধরুন পেশেন্ট এ ব্রেস্ট ক্যান্সার হয়েছে বহরমপুরে থাকে, আর পেশেন্ট বি ব্রেস্ট ক্যান্সার হয়েছে সে বারাসাতে থাকে। দুজনেরই স্টেজ 3 ব্রেস্ট ক্যান্সার, হ্যাঁ, বারাসাতের মহিলা এবং বহরমপুরের মহিলা, কিন্তু দুজনেরই চিকিৎসা এক নাও হতে পারে। আই রিপিট, স্টেজ 3 ব্রেস্ট ক্যান্সার ফর পেশেন্ট এ আর পেশেন্ট বি, মানে একই ক্যান্সার ব্রেস্ট ক্যান্সার, তার কিন্তু চিকিৎসার অঙ্গ আলাদা হতে পারে। কারুর হতে পারে সার্জারি এবং পরবর্তীকালে কেমোথেরাপি বা রেডিওথেরাপি, কারুর হতে পারে আগে কেমোথেরাপি টিউমার ছোট করে তারপরে সার্জারি। তো এটাকে বলা হয় সিকোয়েন্স অফ ট্রিটমেন্ট। কার সার্জারি আগে হবে, কার শুধু রেডিওথেরাপি ট্রিটমেন্ট হবে। আজ থেকে 20 বছর আগে ভয়েস বক্সে যে ক্যান্সারটা হতো, মানে ল্যারিংস, একটু আগে যেটা বললাম, সেখানে ল্যারিঙ্গেক্টমি বলে একটা অপারেশন করা হতো, যেখানে পুরো ভয়েস বক্সটা রিমুভ করে দেওয়া হতো, এবং সেই পেশেন্টটা যদি বেঁচে যেত ক্যান্সার থেকে, সারা জীবন কথা বলতে পারতো না। হি ক্যান or she cannot talk for lifetime. So what a quality of life he or she used to have, that he or she has to live without able to talk. একটা ভয়েস বক্স, আর্টিফিশিয়াল ভয়েস বক্স ইউজ করে হয়তো একটা কোনো রকমের আওয়াজ বেরোতো বা লিখে লিখে কথা বলা হতো। তো এখন উন্নত পৃথিবীতে ভয়েস বক্স রিমুভাল ল্যারিঙ্গেক্টমি সাধারণত করা হয় না আর্লি ভোকাল কর্ড বা ল্যারিংস বা ভয়েস বক্সের টিউমার। এখন অনলি রেডিওথেরাপি ক্যান কিওর আ ভয়েস বক্স টিউমার in 90% of the situation. But I would say again, ভয়েস বক্সের টিউমার, সেটা যদি আর্লি টিউমার স্টেজে ডায়াগনোসিস হয়। কিছু কিছু ক্ষেত্রে ধরুন রিল্যাপস হলো বা অ্যাডভান্স স্টেজ হলো, তখন হয়তো ল্যারিঙ্গেক্টমির মতন মেজর মিউটিলেটিং সার্জারি করতে হয়, যেখানে ভয়েস বক্স রিমুভ হয়ে যায়। বাট দ্যাট ইজ নট ইন আর্লি স্টেজ। আর্লি স্টেজে কিন্তু শুধু রেডিওথেরাপি দিয়ে কিওর হলো, পেশেন্টের কোয়ালিটি অফ লাইফ ইজ রিটেন, patient can talk for lifetime and have a normal voice like his other family members, like his neighbor, like his office colleague. So that gives a boost to the patient individual who is a cancer survivor. তো আজকের দিনে আলোচনা করতে গেলে we not only have to talk about cancer treatment, but we also have to talk about quality of life. Tribeca once again steps forward. They are the one who is ahead and giving so much of services, paramedical services, which is important. একটা পেশেন্ট ভয়েস রিহ্যাবিলিটেশন, স্পিচ থেরাপি করে কি করে নর্মাল ভয়েসে আসতে পারবে is something which is dramatic, and we really didn't have this facility and services available. And I would again say these services should be also made available to remote corner of the city and the village and the state as well. So that is how we can progress as a team. We have to always understand যে একটা দেশ কিন্তু উন্নতি করতে পারে না unless he or she works as a team. So that is something which we have to work and understand, and we have to shed our egos to understand that a nursing staff, as a doctor, also a paramedical staff, we also have to work যেমন cancer rehabilitation therapy, assisted physiotherapy. He has to work in tandem with a doctor to give that service to the patient, where a patient may improve in his or her quality of life. That gives him that confidence to live. So that is also part of the treatment. So
Thank you so
surgery
much,
is
sir.
one.
Yes, sir.
So
Continue.
other,
I'm so sorry. Continue, sir.
yeah,
I'm sorry for the interruption.
yeah, please continue.
Okay. So our next question is, do you think psychological support and counseling in cancer helps in recovery?
Yes, psychology and counseling is very, very important, and in fact, a pivotal structure for a cancer therapy as large. Why we are saying we have learned more, as you are saying, psychology and counseling has come a big way. Now, having said that, I would say that there is still a stigma. I think we are talking for more than 1.5 hours, so everybody has a patience threshold. So I don't want to intervene your attention span on a work day evening, or rather a week evening. So I mean, just bolte chai, the psychology counseling is something which is very, very important. And again, COVID pandemic has taught us in a big way. আমাদের সবাইকার এই র্যাট রেসে সময় হয়েছে to look, sit back and introspect the meaning of life. You know, Aristotle is acclaimed as the father of biology. Even he could not define life. Life is such an abstract thing. And we really, in 1919, bore in such a big way the pandemic, what is in the true way, we again experienced 100 years later through this COVID. And world over, we realized that we have lot to do to understand each of us in a better way. And as you know, psychology counseling is something which has been a requirement for everybody. You have seen in Bengal, so many doctors have died, and they died not only because of COVID in last 1.5, 2 years, because of the mental trauma. They understood more about COVID than the general population, and they died before they were actually affected because of the mental burden. They understood that COVID can create a havoc to the society, and that actually had led to more number of deaths in healthcare workers amongst doctors in Bengal only. Leave apart India and world over. I mean, we don't want to share that data. But what I am trying to say is, more we get educated, more we are aware, more we realize how much backward we are. We have to step forward. So psychology is a subject which has been included into the syllabus curriculum of a medical graduate, যেটা এতদিন ছিল না. Psychology has become an essential ingredient, a topic of discipline which every physician has to learn, and physician cannot do that because of the burden of profession he or she has. So we have to have an assisted psychology discipline in different institutions where psychology counseling has to be taught, and this psychology counseling routinely has to be followed and done in different office premises, institutes to motivation. মানে ছোট ছোট মন্টেসরি স্কুলে চাইল্ড সাইকোলজিও এখন ইন্ট্রোডিউস করা হয়েছে দ্য সিলেবাস টু স্টাডি the behavior of a child. Child behavior is also very important. We used to ignore. এই 1.5-2 বছরের বাচ্চারা, বাবা মারাও নয়, বাচ্চাদেরও স্ক্রিন টাইম বেড়ে গেছে, তাদেরও কিছু করার ছিল না, তারাও সারাদিন টপে বা যাই হোক কম্পিউটারে খেলাধুলা করেছে. But we never realized what actually they need. The peer group, the school children, their friends, they have to interact with them, have a normal well-being and upbringing. So psychology helps in fighting the cancer in a better way. Actually, you can become a survivor, but you cannot be a survivor unless you are a winner. So if you have to be a winner, psychological boosting is an important essential gradient. And I believe every cancer survivor has a moral responsibility because gone through the phase of that fight by himself or herself. সেই জন্যে a cancer survivor knows best. In fact, he or she knows better than me. I am sitting on the other side of the table. I am just declaring the treatment. But a cancer survivor who has faced the odds by himself or herself knows it in a better way, pathway, because initially at a stage of আমরা বলি যখন ক্যান্সার ডায়াগনোসিস হয়, ব্রেকিং দ্য নিউজ, দ্যাট ইজ ইটসেলফ আ বিগ চ্যাপ্টার. প্রথমে হয় স্টেজ অফ শক, দেন ইজ দ্য স্টেজ অফ ডিনায়াল. না, আমার ক্যান্সার হতে পারে না, ডাক্তারবাবু কিছু একটা ভুল করছেন, আমার আবার টেস্ট করা হোক. সো দ্যাট ইজ কল্ড ডিনায়াল. শক মানে you don't know how to react and you just give up everything in life. You may feel that you want to commit a suicide. This is stage of shock, and ultimately is stage of realization or understanding when you cope with the treatment. So stages through which a cancer survivor goes, and one who survives, he or she knows better than other healthcare survivors, also a cancer oncologist. And I think everybody should have some moral responsibility. I always influence, and there are few of them who are also present in the meeting. I can see their names popping up on the screen, is there today, and I would say that everybody of you should take up a bit of the responsibility to give back to the society, where the society so desperately needs today to fight not only cancer, but as an individual, how healthily we can grow. So that is very important. Psychology counseling plays an important role, and it is part and parcel of a cancer treatment. It cannot be, the cancer treatment can go on without psychology and counseling.
Thank you, sir.
Thank you.
So we can definitely say that if there is a will, there is a way. So we have to be strong from our mind. We have to be strong within our brain. So moving on to my next question, which is, we often hear about.
Do we really have a question?
I'm sorry?
Do we really have a time for a question? Are your audience really in a mood to listen to it? I am not very sure. If they are exhausted, we can always divide and go on discussing this. Maybe next week or next week we can have now physical meeting also in small groups, and I would be more than happy. Rebecca, let me use this platform to tell you that amra kintu small groups say we can organize a meeting, take up a subject like, as you said, psychology, counseling and therapy, women can breast cancer, and in different platforms there are so many topics which can be discussed. I'm sorry for interrupting. We can, if you say that we can continue, then I will be more than happy to continue.
I think, sir, I have one last question, and that is quite important, which is there any vaccine for cancer?
Oh, very lovely question. The world over is doing a lot of basic research, and with the vaccine coming for treatment of COVID, and we realize first vaccine, second vaccine, তারপরে booster, তারপরে second booster. Now, why this is so? We were not educated enough to understand actually what is the meaning of vaccine, how does it function, and what is the role, how much time it takes for the vaccine development, and how much immunity actually in real sense term does it provide to an individual from a particular disease. Now I will be very brief about the discussion. Vaccine is something which is a preventive treatment. Eতক্ষণ we were discussing about therapeutic treatment, right? Now vaccine is a preventive treatment, which is very important. Again, as we are developing, as mankind is developing, as humanity is growing over last so many years and decades and centuries, we have to understand there should be some mechanism of prevention of some diseases which is causing havoc to the society. So cancer is one such disease. There have been so many vaccines which are available. আমাদের আজ অনেকদিন থেকে ইমিউনাইজেশন শিডিউল আছে, বাচ্চারা জন্মালে পরে পিডিয়াট্রিশিয়ান ডাক্তারবাবুরা মাদের বাবাদের ধরিয়ে দেওয়া হতো ভ্যাকসিন চার্ট, একটা ইমিউনাইজেশন শিডিউল যেটাকে বলা হয়। Now this has expanded and made modified in a very big way in last 1 or 2 decades. There are a lot of vaccines coming to reference to cancer treatment. I would say there has been a lot of vaccine development also. Most important to head the way is the HPV vaccine, human papilloma virus, which is the cause or which is the reason or a predisposing factor for cervix cancer, যেটা একটু আগে আলোচনা করলাম, that is tip of the uterus. Now cervix cancer is a preventable cancer because majority 70 to 80% of cervix cancer is because of a virus infection called HPV, human papilloma virus. So HPV virus was a foreign thing. It was a Greek word to all of us even 10 years back, and today we are proud to say we have a vaccine like HPV vaccine, which should be given to all women above 12 years till 40 years to prevent a cancer like cervix cancer. Now you may ask me, I will just respond to it, why this this vaccine is not so prevalent or not so unanimously given like polio vaccine যেরকম ভাবে দেওয়া হয় বা কোভিড এর ভ্যাকসিন যেরকম ভাবে নেওয়া হচ্ছে বা এইচপিভির ভ্যাকসিন সেরকম ভাবে সব মহিলাদের কেন দেওয়া হচ্ছে না, বা অনেকেই হয়তো এখানে 25 জন আছেন, তাদের মধ্যে সবাই হয়তো এই ভ্যাকসিনটার নামও শোনেননি, হয়তো আবার 5-6 জন এখানে আছেন যারা নাম শুনেছেন, বাট কতটা ভ্যাকসিন প্রযোজ্য বা কোথায় দেওয়া হয়, কাদের দেওয়া হয়, কাদের দেওয়া উচিত এবং দিলে কি লাভ, দিলে কি ক্ষতি, সেইগুলো সম্বন্ধে হয়তো বিস্তারিতভাবে জানা নেই। But having said that, there was a lot of controversy in our regulatory body called ICMR. ICMR is our regulatory body which controls যে কোন ড্রাগটা বা কোন ভ্যাকসিনটা has to be approved by our regulatory authority to be used. Now HPV had a lot of controversial in last early 2000s and 2010 till 2015, but last 3 to 4 years it has crossed all the hurdles and it is in the stage of regulation. Maybe in 1 to 2 years this will be routinely ascribed to all women from age group বললাম যেটা 12 বছর থেকে 40 বছর অবধি সব মহিলাদের দেওয়া হবে, and that can prevent an important disease like cancer cervix. এরকম আরো অনেক ভ্যাকসিন আছে, সেইগুলো is also helpful for prevention of, again, one of cancer. There is no such vaccine which can prevent all cancers at one shot. এরকম কোনো one shot vaccine আবিষ্কার হয়নি, but there is no research going on. There is a one research going on about dendritic cell vaccine, which is in still stage of research. Dendritic cell vaccine একটা vaccine যেটা কিন্তু a group of cancer can be prevented, but it is in still stage of research. Other cancers are all, other vaccines are also being developed, যেমন AIDS এর vaccine বা আমরা বলি ইবোলা ভাইরাস একটা আছে, ইজিবিভি, যেটা ইবিভি ভাইরাস, যেটা নাকের ক্যান্সার করা হয় অনেক। তো সেই ভ্যাকসিনের উপর কাজ বা তথ্য চলছে, রিসার্চ চলছে। In coming years we'll have maybe another 3-4 vaccines which will be approved and in clinical use. But till date, vaccine is something very good because it is a prevention strategy. It is not treatment. That money you save millions of dollars and millions of rupees for treatment if you use this vaccine for the society, because in that case disease is not happening. That means treatment is not required, hospital resources infrastructure is not used, medicine is not used. A lot of expenses can be curbed or prevented if vaccine can be used. So vaccine has an immense role to play in coming years so far as the society is concerned. So that is one thing which also needs further discussion. Thank you, Ananta, for putting up this very interesting question.
Thank you so much, sir. Now, I would like to ask our audience if they have any question, then they can directly ask Dr. Chatterjee. You may raise your hand and I will unmute you. You can directly ask your question to Dr. Chatterjee. I repeat, if you have any question, then you can raise your hand. I will unmute you and you can directly ask your question to Dr. Chatterjee.
Hello.
I think everybody is so exhausted, but I certainly most welcome if anybody has any question. He or she may be thinking it is silly, but definitely you can ask a question or you can write in the chat box. Samra, we can get back in our next session also. So yes, Shubhasri wants to ask something.
Yeah, so I want to ask, for example, suppose if my mother has colon cancer, can I inherit some different cancer, or it will be always be a colon cancer?
Oh, very good, Shubhasri. That is very intelligent question. Say, I would say, I was discussing, and I think I told you also that probably later on I'll discuss, because she is recently diagnosed and just ongoing treatment. But your age is still not matured enough that you need to undergo immediate screening. But certainly colorectal cancer যদি মার হয়ে থাকে, there is some point of risk in your lifetime to have a colorectal cancer only, comma, having said that, there is still lesser risk but a quantum of risk for developing breast and ovary cancer also. এইটাই হলো cancer geneticist can study that, depending upon what cancer your mother has and what cancer you can, by doing a genetic mapping of your blood test, we can do a array of investigation to understand you have any mutations which has already in your cell line, or you don't have any mutation, you just happen that you have a family member, money your mother, having a cancer. So a risk of having colorectal cancer is little bit more in your lifetime, maybe 20 years, 30 years later, or maybe 10-15 years later. But that doesn't mean that you don't have a risk for breast ovary also. Unlike your another cousin from your paternal side, মানে পিস্তত ভাই বা পিস্তত বোনের সেই রিস্কটা থাকবে না, কারণ দে আর অন ইউর ফাদার্স সাইড। বাট ইউর মাদার্স সাইড, মাস্তত বোনেরও বা দিদি বা মাসি বা দিদা বা মায়ের বোন, যেটা বললাম মাসি, বা তোমার নিজের বোনের ওই রিস্কটা আছে ফর কোলোরেক্টাল একটু বেশি। বাট ব্রেস্ট আর ওভারিরও আছে ডেফিনেটলি কম রিস্ক, এবং সেই রিস্কটা আরো কোয়ান্টিফাই করা যায় থ্রু জিন ম্যাপিং স্টাডি। তো সেটা 0.2% বেশি না 0.5% বেশি by doing those genetic tests. And we are still, কিন্তু আমি বলি, having said that, I would say, Shubhasri, we are still not matured enough with full bloom data that we can tell you exactly you have 19.8% risk of having colorectal cancer in next 7.5 years. এইরকম ভাবে প্রিসিশনে আমরা উত্তর দিতে পারবো না. We are still in the learning phase, but broadly we can give you, today the science has progressed too much to give you a broad idea. See, next 20 years তোমার colorectal ক্যান্সারের রিস্ক কত, আরো 2-4টে জেনেটিক টেস্টিং করার পর, এবং নেক্সট 10 years তোমার ব্রেস্ট ক্যান্সার ডেভেলপমেন্টের কত রিস্ক আছে. বোঝাতে পারলাম?
থ্যাংক ইউ.
Shubhasri, did you understand me? Kichuta?
Yeah, yes,
Don't
thank
expect
you, sir.
to understand 100%.
And I
Because
have one more question. Yeah,
Please be
so I
loud.
have one more question.
I
I have one more question.
Yes.
Yeah,
Shubhasri.
so can we downstage cancer? For example, if someone gets diagnosed as stage 3, can treatment help to downstage it to stage 1? Or does it work like that?
হ্যাঁ, দেখো ডাউন স্টেজ তো হয় ডেফিনেটলি ইন ইওর মাদার্স কেস. মানে আমরা কোলোরেক্টাল ক্যান্সার, ওভারিয়ান ক্যান্সার, ব্রেস্ট ক্যান্সার, এই 3-4টে ক্যান্সারে, না ইভেন অলসো ইন স্টমাক ক্যান্সার, এই 4টে ক্যান্সারে আমরা ডাউন স্টেজ কথাটা খুব খুব কমনলি ব্যবহার করি, কারণ এইখানে সার্জারি ইজ দ্য মেইনস্টে অফ ট্রিটমেন্ট. এখানে chemotherapy plays an upper role because the stage may be little advanced, that may be stage 3 or stage 4, as in your mother's case. So here we give chemotherapy to downstage the tumor to see to it that whether she is fit for or amenable for a surgery in later on stage 2 or phase 2 to be more precise. কারণ আমরা যদি সার্জারিটা অফার করতে পারি ওনাকে, তাহলে there is a potential chance of cure. কারণ শুধু chemotherapy in this cancer will not cure the cancer for a long duration of time. It can arrest the cancer for a period of time, but this cancer will again come back in coming, say, 9 months, 15 months, 16.5 months. So our purpose is to downstage the tumor, debulk the tumor to a stage where she is not fit for surgery now, because surgery করলে আমরা রেসিডুয়াল ক্যান্সার রেখে ফেরত আসতে হবে বা খুলে আমাদের সার্জন বন্ধ করে দিতে হবে, বিকজ সার্জারিটা করা যাবে না. তার জন্য কেমোথেরাপি দিয়ে সেটা এখন ছোট করা হচ্ছে, ডাউন স্টেজ করা হচ্ছে, শ্রিঙ্ক করা হচ্ছে, ডিবাল্ক করা হচ্ছে, তারপরে সার্জারিটা করা হবে. কারণ তখন এই আশা করি সার্জারিটা করা হবে, তখন সার্জারিটা ফুল প্রুফ সার্জারি করা যাবে. হ্যাভিং সেড দ্যাট, সব সময় কেমোথেরাপি দেওয়া মানে ডাউন স্টেজ নয়, কিন্তু লিম্ফোমা ট্রিটমেন্টে কিন্তু কেমোথেরাপি ইজ দ্য অনলি ট্রিটমেন্ট which can, কিছু লিম্ফোমা, আবার বলে দিই, কিছু লিম্ফোমা, not all lymphomas, যে chemotherapy 4টে cycle is all the treatment we give to the patient and the patient is cured of treatment and cancer. So they are all different types and methods how it functions. So I am always there to explain to you that each tumor, each site, each stage, for each individual, the treatment package is different from patient to patient A to patient B. So certainly downstage is something which is a broad spectrum. We use in few cancers like ovarian cancer, colorectal cancer, stomach cancer, যেটা বললাম টিউমারটাকে যাতে এখন ছোট করার উদ্দেশ্য, so that in phase 2 we can do a good surgery. What is a good surgery? We do a R0 resection, মানে পুরোটাই আমরা অপারেশন করে বাদ দিতে পারবো, সেই আশা করেই করা হয়. হয়তো 70% we become successful as doing an R0 resection, 30% we do a surgery but we do a R1 resection, কারণ পুরোটা বাদ দিতে পারলাম না. Another 30% we realize না হয়তো কেমোথেরাপি দিয়ে ছোট হয়েছে, বাট এমন ছোট হয়নি যে সার্জারি করা যাবে. So we have to think about giving a second line chemotherapy in that situation. So they are the way how you deal with each cancer in each stage, which may be very complicated to understand in one sitting, because as I told, cancer is a heterogeneous disease. প্রত্যেকটা ক্যান্সার, মানে লাং ক্যান্সার যেমন ডিফারেন্ট ডিজিজ, both the cause is different, the treatment is different, the follow-up is different. Similarly, for a vocal cord cancer, the cause may be different. For a urinary bladder cancer, the cause may be different, the treatment may be different, the diagnosis may be different, the follow-up may be also different. So it is a very holistic approach where an oncologist deals with the cancer. And in coming years, an oncologist will be also site specific. মানে একজন ডাক্তারবাবু হবে উনি শুধু ব্রেস্ট ক্যান্সারের চিকিৎসা করে। He is not qualified to understand anything about lung cancer. So we are talking about or thinking in coming years like Tata Memorial Hospital, my place. My fellow colleague who is a specialist only treats lymphoma. He doesn't know anything about breast cancer. He is not qualified enough. So he is only day in and day out only looking after lymphoma patients and this treatment. So that is how we call a subspecialty training, where only I deal with one type of cancer in different stages. And that also only radiotherapy breast cancer. There's another group of doctors, medical oncology, who is treating breast cancer with chemotherapy. He doesn't know anything about radiotherapy. So this is how we are progressing over a period of time in coming years. That is the way forward. We have to do as a team, but again, we have to have an individual charisma and qualification and skill to deal the utmost complicated procedure to give a better chance of cure, preserving the quality of life. And again, quality of life important. We cannot just treat the disease, we have to treat the patient as a whole.
Thank you.
So,
Thank
I
you,
am
sir.
over.
Thank you so much, sir. We have another person, Ms. Madhumita Sen. Can you please unmute yourself and ask your question to Dr. Chatterjee?
Yes, good evening. Doctor told that it is a genetic. There's no genetic history in my family, but why did I got cancer? That is a big question for me.
Madhumita, if you have missed the first part because we were in the OPD some time back, and I know you were traveling back home or তুমি হয়তো প্রথম দিকটা মিস করে গেছো, but as I told you, 20% of the cancers can be familial. মানে you have acquired the gene or rather congenitally acquired the gene from your parents. But having said that, 80% of cancer or carcinogenesis or tuberogenesis can happen in your body during your lifetime as an individual as you are growing. So 20% you can congenitally inherit a gene. So two words, one is inherit, another is acquire. Both terms are very separate, different terms. Inherit is 20%, where you inherit the gene from your parents, and then after the age of 35, after the age of 45, after the age of 60, you can develop. Those genes can flare up in form of a cancer, and majority, that is 80%, you have not inherited those genes, but you have acquired those genes. There is some triggering factor which has a cohesion of factors. Maybe some are the lifestyle factors, some are the risk factors, or your gene has triggered in such a way during that cells multiplying and dying, they have multiplied and they have failed to die because of some genetic trigger which has happened, some genetic point where the process, the method, the physiology which is happening every day in and day out in our body, that cells multiply and then cells die, then again new cells form. তো এই যে প্রসেসটার মধ্যে থেকে কোথাও একটা জেনেটিক ট্রিগার কাজ করেছে, যে জেনেটিক ট্রিগারের জন্য এই মেকানিজমটা ডিস্টার্ব হয়ে গেছে, এই মিলিউটা has been disturbed and distorted, which has resulted in an abnormal thing because of mutation. তার মানে তোমার বডিতে acquired mutation হতেই পারে in 80% of the situation where you have not inherited those genes, and that led to cancer formation. So studies can prove whether you have those inherited genes which caused, or the acquired one which can cause. So we, in the process of learning and educating, as this basic research is tremendously developing world over, we are learning this more and more every day, and there is no end to that. Millions of dollars are spent world over globally to understand more about how different cells behave, each and every individual cells in our body behave, and its relationship with the genetic map. Map bolte Australian map, Indian map, West Bengal map, Sundarboner map. These are the map যেটাকে বলছি, মানে একটা ম্যাপের ডিটেল স্ট্রাকচার দেখতে গেলে সুন্দরবনের মধ্যে ঢুকে গেলে মানে অনেকগুলো শহর আছে, আইল্যান্ড আছে যেগুলো সুন্দরবনের মধ্যে পড়ে, হয়তো আমার তোমার জানা নেই। ঝড়খালি একটা নাম, এরকম আরো 7-8টা নাম আছে, আমি এক্ষুনি বলতে পারবো না। তো এত complicated, when you get into the human body, there are millions of cells and millions of genetic maps which are there every day, day in and day out. They are functioning in their normal process, যার মাধ্যমে সেল ডেথ হচ্ছে, আবার মাল্টিপ্লাই, সেল গ্রো করছে, মাল্টিপ্লাই করছে, আবার সেটা ডেথ হচ্ছে। সেটা হেমোগ্লোবিনটা একরকম করে, ডাব্লিউবিসি একরকম করে, প্লেটলেট একরকম করে, ডিফারেন্ট লাং সেলস একরকম ভাবে করে, ইউটেরাসের লাইনিং সেলস আরেক রকম ভাবে করে। সো দে আর ডুইং দেয়ার র্যাপিড ফেনোমেনন অফ ওয়ার্ক। যেমন একটা ইন্ডাস্ট্রিতে বিভিন্ন মেশিন একসঙ্গে এক একটা জায়গায় চলে, তো সেরকম ভাবে বডির মধ্যে দিস different machines are working in a different fashion at same time, in different way, multiple. We don't know that complex process which is happening. এর মধ্যে কোনো একটা জায়গায় কোনো triggering mechanism that may be triggered by an extrinsic factor, like an individual who has a habit of taking alcohol for a long period of time, along with a tobacco abuse for a long period of time, তার সঙ্গে ধরো তার অকুপেশনাল এক্সপোজার আছে, বা ওবেসিটি আছে, বা সেডেন্টারি লাইফস্টাইল আছে, নো ফিজিক্যাল অ্যাক্টিভিটি. So they help in triggering the predisposing position of augmenting the risk of cancer or carcinogenesis happening in one tissue, maybe in the breast, or maybe in the lungs, or maybe anywhere in the body. That can happen from head to toe. Yes, Madhumita.
And the second question is stage 2 cancer fully curable?
Yes, as I discussed, stage 1 and stage 2 falls in the early cancer group. So Jekono stage 1, stage 2 has a very, very high potential of cure because they are in the early cancer group. And we can proudly say in majority of the cancers, they are curable cancer. Having said that, there is again a small rider. Sorry, we are exhausting lot of time and lot of attention span. But having said that, the word cure in cancer is actually a misnomer. I'm pausing and repeating the word again. Cure in cancer is something which is actually a misnomer. That is not the right word to be used in cancer. We say a 10 years survival or a 5-year survival chance, 70%, 50%, or sometimes 2 years chance of survival, even in some cancers like cholangiocarcinoma, bile duct hoy. সেখানে কিন্তু stage 1, stage 2 cancer has a very bad prognosis. Broadly, we say stage 1, stage 2 is early cancer, but very good chance of potential cure. But having said that, we also say that some cancers, even in early stage, though very good chance of cure, they may come back with a second cancer because of the treatment. Now, what I mean by that, the chemotherapy বা radiotherapy treatment itself করার জন্যে long term, 4 years, 8 years, 10 years বাদে there can be a second cancer because of the treatment we have given with chemotherapy or radiotherapy, which has led to some aberrations or mutations in the cell, which can trigger a cancer of the same individual 12 years later, 15 years later. But that cancer is not the same cancer as this cancer. This cancer in stage 2 is cured or controlled. In fact, we say it is controlled. 15 years hole poreও আমরা কথায় কথায় বলি cured, but in medical science, in cancer, we say it is cured, not cured, but it is controlled. সেটা 12 বছর হলেও বলি, 9 বছর হলেও বলি, বা 14 বছর বলেও বলি। But a second cancer can happen. But having said that, I may answer to your other question which is popping in your mind, then why you are advocating the treatment if that treatment itself can cause a second cancer. Now it has been studied medically that if the risk versus benefit ratio, the benefit is more than the risk, then certainly the risk is taking worth. তার মানে কেমোথেরাপি স্টেজ 2 তে ক্যান্সার করে আমি যদি তোমাকে 10 বছর 12 বছর বা 17 বছর আয়ু দিতে পারি, দ্যাট ইজ ওয়ার্থ টেকিং। তোমার যেখানে 3% রিস্ক আছে আফটার 12 ইয়ার্স ইফ ইউ ডেভেলপ আ সেকেন্ড ক্যান্সার, 97% আছে যে তোমার সেকেন্ড ক্যান্সার হলোই না। সো ইউ হ্যাভ অলওয়েজ আ বেটার বেনিফিট দ্যান লেসার রিস্ক বাট নট জিরো রিস্ক। So you have a 3% risk of developing a second cancer, say 12 years later, but you don't have a 0% risk. But 97%, if you are taking the chemotherapy treatment or a radiotherapy treatment, you are controlled of the disease in your lifetime. So that is again a statistical expression which is used in a publication or a paper or any research work to prove that it is worth taking. It is not my individual conviction that I am advocating you this treatment because that is what I believe as an expert that it is good for you. It is the research which is giving you a guideline, the level of evidence which says that for Mrs. B in stage 2 cancer in so and so site, maybe breast or ovary or stomach, he or she should be advocated a treatment which is a sequence, maybe only chemo or surgery followed with chemo or other way around, chemo followed with surgery. So this is through a category of evidence, not what Dr. Chatterjee is thinking as an expert that this is right for you. Today's world, there is nobody like he is the supreme author or he is the supreme power. It is the medical science evidence which is speaking about this should. তাই জন্যই প্রথমেই আজকে ডিসকাশনে বলেছিলাম the tumor board is there in major hospitals where cancer facility is there, where a group of doctors, surgeon, oncologists, pathologists, intervention radiologists sit together and decide the course of treatment. You should be taking this treatment in some situation which is tricky, like it's not a straight cut treatment because there may be two treatment options available. Treatment A is also right, treatment B is also not wrong. Both are evidence based, both are approved. So we should give you an option there. What do you want to take? Majority of our Indian patients are not so qualified, not so well read, unfortunately, maybe misread, or lot of information overload is there. Lot of neighbors and relatives are guiding with their experiences, liver part expert, to confuse you at the end of the day. So there should be a proper method which should be advocated and discussed thoroughly before starting a treatment. Because once we start treatment, we cannot go back. So that is a consent which we should also take from a patient. That this should be the method of treatment. This may have some side effects. This may have early side effects, late side effects. This may have an outcome like this. This may have a little bit of risk of having like this, maybe 15 years down the line. But the benefit is more than the risk. So we are offering you this treatment and you should take the final call. Okay, understanding everything. You may take 3 days, 7 days time to take the call. Okay, I understanding everything. I give my written consent to decide on to take this treatment. So that is the way forward. Madhumita.
Thank you so much, Doctor.
Thank you so much, sir, for addressing the questions. And it was a wonderful session. I'm sure our audience are hugely benefited with this. As Dr. Chatterjee said, you can lower your risk of getting many common kinds of cancer by making healthy choices. Screening tests can find some cancers early where treatment works best. Thank you once again from Team Tribeca. And remember, if you need any help, we are just a call away. Thank you so much. Stay safe and stay healthy. Thank you.
Thank you, everybody.
Thank you, sir.
We'll get back on Unna later on.
Yes, sir. Sure.
More of such
Thanks
meetings we
everyone for
will,
joining.
however pressed upon time we are, I think we should still organize meetings. And I believe this session today gives an impetus to one of our audience to organize a meeting. I could see that Ruma was there. She organized a meeting and I was happy. I went all the way to Durgapur just 2 months back and we had a meeting there. Also and educated a section of the people in Durgapur. So these good moments where you also have a responsibility for the society, and I think that is the way forward we can all travel together.
Thank you, sir. Thanks
Thank you.
everyone for joining. Happy weekend.